Hereditary hemochromatosis. Hemochromatosis is a genetic disorder in which the body stores too much iron. Some common symptoms of this disorder include fatigue, abdominal pain, memory fog, loss of sex drive, heart flutters, and irregular heartbeats. More serious, long-term damage that this disorder can yield if untreated includes diabetes, irregular heartbeat or heart attack, arthritis, cirrhosis of the liver, which is scarring, or liver cancer, gallbladder disease, depression, impotence, infertility, hypothyroidism, hypogonadism, and various forms of cancer. Specifically, having too much iron in the brain can also result in Alzheimer's disease, early onset Parkinson's disease, epilepsy, multiple sclerosis, and Huntington's disease. Our understanding of hemochromatosis has only recently been growing. The disorder has only been documented for around 150 years, but it had no substantial understanding until the early 20th century. The earliest documentation of the disease and its symptoms was in 1865, and 24 years later, in 1889, a German pathologist named von Recklinghausen coined its name for its visible symptom and what he believed was the cause, an alteration in pigmentation of the skin due to some unknown agent in the blood. In 1935, Joseph Sheldon, a British geriatrician, concluded that it is a hereditary disorder caused by too much iron in the body. Later, in 1996, it was discovered that it is caused by a mutation to the HFE gene, and this mutation was found in 85 to 90% of diagnosed patients. But it has since been revealed that while this makes up for the vast majority of cases, it does not account for all variations of hemochromatosis. The types of hemochromatosis include type 1, the most common type, also referred to as classical hemochromatosis. Symptoms generally start between 50 and 60 years. Type 2, also referred to as juvenile hemochromatosis, with symptoms manifesting at a much earlier age than the other types. Type 3, sort of an intermediate type between type 1 and type 2, with symptoms showing before the age of 30. Type 4 is similar to type 1, it is simply less common. Type 5 is extremely rare. This type has only been documented in one family from Japan. While symptoms do not appear immediately, hemochromatosis is present at birth. There are currently no prenatal tests, though, that can be done to determine if hemochromatosis is present. Additionally, this disorder is not among the disorders the state of Missouri tests for in newborns. However, if liver failure is observed in a baby prior to birth, hemochromatosis is suspected to be present, but no diagnosis can be made until after birth. There is another type of hemochromatosis that is a distinct outlier. It is called neonatal hemochromatosis, and while it is technically a form of this disorder, its cause is not entirely understood. And if a woman has a child with this disorder, she has an 80% chance of all following children having the disorder. While neonatal hemochromatosis is not hereditary, it is considered congenital. The most likely cause is that the disorder manifests as an alloimmunity disease. Alloimmunity is when two like bodies are introduced, but one sees the other as foreign and attacks it. This is similar to a blood transfusion between two blood types, and the body rejects the blood, attacking it with antibodies. In a healthy pregnancy, the mother's body actually protects the fetus by sending antibodies to attack foreign bodies, but they mistakenly recognize the fetus as being foreign and thus attack the fetus. But between the 5 hereditary types of hemochromatosis, what makes them different? The resulting symptoms and damages of each type are virtually identical, and the treatment for all 5 is the same. The difference actually lies in the gene mutation that causes the disorder. The subsequent difference is that the specific type will dictate when the symptoms appear, as listed with types 2 and 3 above. In addition, the gene mutation associated with each type dictates how the disorder will be inherited. Everyone inherits one of each gene that can lead to hemochromatosis from each parent. Types 1, 2, and 3 are inherited in an autosomal recessive pattern. This means that each parent needs to have the mutated gene and pass that mutated gene on in order for the disorder to be inherited. Types 4 and 5 are inherited in an autosomal dominant pattern. This means that only one of the parents needs to have the gene mutation and the disorder will be passed on. The gene location for type 1. Type 1 is caused by a mutation to the HFE gene, found on the short arm of chromosome 6 at position 22.2. There are 2 genes whose mutations can cause type 2. This one shown here is the location of the HJV gene at position 21.1 on the long arm of chromosome 1. The location for the second gene for type 2. This is the HAMP gene, located at the position 13.12 on the long arm of chromosome 19. Type 3 is caused by a mutation to the TFR2 gene, located at position 22.1 on the long arm of chromosome 7. Type 4 is caused by mutations to the SLC40A1 gene, located at position 32.2 on the long arm of chromosome 2. Type 5 is caused by a mutation to the FTH1 gene located at position 12.3 on the long arm of chromosome 11. Caucasians have the highest risk of inheriting hemochromatosis, and within that, men are more likely to develop the symptoms at an earlier age, but the risk in women increases after menopause. The reason this is the case is because the regular loss of blood in the menstrual cycle actually helps to curb the increased levels of iron in the blood. There are 3 tests that can be done to diagnose the disorder, and are most effective when done together. The first of these being serum iron. This test measures the total amount of iron in the body. In healthy adults, there should be between 50 and 150 nanograms per milliliter of blood. Patients should fast for at least 3 hours prior to the test and discontinue any vitamin C and iron supplementation. The second being serum ferritin. This test measures the amount of a certain protein in the body called ferritin. Ferritin is the primary carrier of iron in the body, and this test provides a clear estimation of how much iron is actually in the body. The third being total iron binding capacity, or TIBC. This test measures the maximum concentration of iron that can be carried in a given volume of blood. All 3 of these tests could be done individually, but are drastically more effective when done in tandem. Genetic testing can also be done to confirm a diagnosis. When hemochromatosis is diagnosed early and treated before organs are damaged, a person can live a normal life expectancy. For people who have a late diagnosis, life expectancy may be shortened depending on the disease. If a person is diagnosed and treated before serum ferritin is above 1,000 nanograms per milliliter, the risk of liver cirrhosis or liver cancer is less than 1%. The primary treatment for hemochromatosis is known as therapeutic phlebotomy, also referred to as TP. TP is simply blood removal, and it is done the same way blood donation is done, but is typically required much more regularly. Blood donations are done about once every 8 weeks, but someone with hemochromatosis may require TP 8 times in 1 month in order to bring iron levels back to the desired range of 50 to 150 nanograms per milliliter of blood. After the desired iron levels are achieved, the diagnosed can begin less frequent TP sessions of once every 2 to 4 months. But the frequency of TP may vary depending on the individual's diet and how quickly their body absorbs iron. For anyone who may not be able to perform TP, there is an alternative option called chelation. It is a medication received either through injection or a pill, and it causes excess iron to be expelled through urine. For more information regarding hemochromatosis, there are many helpful resources online. I provided links to a handful of those resources down below. Thank you for coming to my TED Talk.